Okay, so let's go back and just keep peeling the spontaneous breaths back a little bit. Beneath pressure support is what's called TC. TC is our acronym for tube compensation. So tube compensation has caught on in popularity as a more synchronous as well as simpler way to let the computer manage how much pressure does the patient need. So you'll recall that tube compensation wants to know something about the artificial airway, because the machine is now going to use the least amount of pressure. It's going to calculate and figure out that number on its own, the least amount of pressure to overcome the artificial airway. So you need to go ahead and enter in the patient's artificial airway information. So what size lumen is the endotracheal tube or trach tube, right? Short straws, long straws. My test lung actually is a 10-0 trach, so I am going to put 9.5, that's 10 for trach. You notice that you have alarm parameters next to the artificial airway. Remember what these are now. High peak airway pressure, that's your PIP alarm, and we talked about this one earlier. High inspired spontaneous tidal volume limit. Barotrauma, volutrauma. Hey, ventilator, don't let the patient take a breath larger than X. So that's your discretion where to put that. The only other setting other than the common oxygens and trigger is what we call percent support. And that basically is telling you how much of the artificial airway do we want to overcome. You want to overcome all of it. So you're almost always going to use that at 100% support. I personally have never seen it used less than 100%. You could think of using it at 50% or something lower if you're worried about a difficult intubation or a very risky airway where I really don't want to remove this tube and get it wrong. So you could turn down percent support and kind of treat the patient as if they had a smaller and smaller tube, but they really don't. I would just leave it at 100%. Press accept. Okay. So, spontaneous, big red S up here. It says Spont TC, so you are in tube compensation. And if you take a look at the graphics, you can kind of see that we now place this shadow tracing underneath the pressure time curve. And the shadow is a reflection of pressure after the artificial airway. And a little tough to see, but that says P carni or carinal pressure. So it's pressure after the artificial airway, meaning lung pressure. It's an estimate of how much pressure got through the circuit and ultimately on the other side of the endotracheal tube. So you might see a little bit of a gap between circuit pressure, the red line there, if you can zoom in on that, and ultimately the shadow pressure. And the wider that gap or space between circuit pressure and shadow, that kind of lets you know that the artificial airway is beginning to narrow and narrow and narrow because it's not snapping across the tube as nicely as it was, say, yesterday. So that's why the shadow's there. You don't have to leave the shadow if you don't want to. You can touch plot setup. Remember, you can identify what the scalars are. You can also disable the shadow and just treat it as if it was any other pressure waveform. Okay, so how much pressure support is my patient getting? That would be a terrible question to ask. Your patient is getting, first of all, support pressure. It's not pressure support because there's nothing fixed about the pressure. If your patient pulls hard, the ventilator is going to push hard. If the patient pulls softly, well, the ventilator is going to push softly. So it's kind of an effort-dependent approach. And remember, the machine is going to calculate how much pressure is needed each breath based on effort and based on artificial airway resistance. A little bit of information. If you touch the clipboard, we're going to give you heads-up displays of information pertinent to spontaneous breathing, right? So you still have the 4 that we had earlier in terms of flows and compliance, but you notice there's a couple other parameters now, and a really nice one. Remember, if you don't know what it is, you got to touch it and it'll tell you. F to VT, that's your rapid shallow breathing index. So if you're using tube comp or pressure support or any spontaneous mode on the 840, open the clipboard and you're going to get a lot of information, including a heads-up display of RSBI, or F to VT as we call it, just to help you kind of do the math quicker and get along and work efficiently. So that's kind of nice. You put it into standard view. There's your F to VT here, a little bit about timing, spontaneous inspiratory time, and things that I think make a lot of sense to you, the spontaneous minute volume, or you can put it on the respiratory mechanics page and get some lung flow information. Okay, so that's tube compensation.